Hello and welcome. We're very excited to have you here today to join us for this very important webinar topic, LSVT Loud and LSVT Big Mythbusters, what you need to know. My name is Elizabeth Peterson. I'm a speech language pathologist and one of the LSVT Loud training and certification faculty instructors. I'm joined here today by my colleague Laura Gousset. She's a physical therapist and one of the LSVT Big faculty instructors, and she's also the LSVT Big Chief Clinical Officer. So we will be the two presenters here today talking to you about this topic. And I just want to go over some of the disclosures. Both myself and Laura, again, are LSVT faculty instructors, so we both have financial and non-financial relationships with LSVT Global. Non-financial relationships include a preference for LSVT Loud and LSVT Big as treatment techniques. As far as financial relationships, both myself and Laura are employees of and receive lecture honorarium and travel reimbursement from LSVT Global. I'd like to briefly go over the plan for the webinar so you know what to expect here today. First, I'll cover some logistics, and then Laura and I will get into kind of the heart of the webinar and present the content that we have prepared for you today. Then we'll take some time at the end of the webinar to address any of the questions from the audience. And at the very end, when you exit out of the webinar, a survey will display on your screen. It should only take a few minutes, and we do appreciate if you're able to respond to that. It helps us with our webinar planning and lets us address any lingering questions that you may have, and then also just to improve our webinars overall. So we do appreciate your responses there. In terms of logistics, right now, everyone in the audience, your microphone is automatically muted. And that's just to make sure that we don't have background noise from the various environments where you're joining us. But if you do have a question during the webinar, there are a few ways to ask your questions. The first is to type in your question, and you can do that by clicking on the question panel or question box on your webinar control panel. Then you can type in your question, and Laura and I will see that question, and we can ask it out loud to the group and address it on air here. You can also raise your hand. You can do that by clicking on the hand icon on your control panel. I'll then see that you have a question, and I'll call out your first and last name to let you know that I'm unmuting your microphone, and you can ask your question out loud to the group. And the third way to ask questions, and this would really be at any time, is to email us, and that's info as in information, so info@lsvtglobal.com. There's also a handout of this webinar, which is the handout of the slideshow that we'll present. You can find that handout in your webinar control panel. If you click on that handouts tab, you'll be able to click a link to it that you'll be able to download. So you can use that during the webinar and have that for your reference after. You'll also receive an emailed copy of that handout if you're joining us live. It looks like there was a power outage at our main office this morning, so I don't know if it got out before the webinar or not. If not, then you'll receive it shortly after the webinar in case you're unable to access it in your control panel here. So these are our instructor biographies. I won't go into detail here, but just letting you know for your reference that you have this in the handout to refer back to. And in terms of objectives for the presentation, this is the way we'll kind of break up the content that we have for you. So the very beginning of the webinar, we're going to discuss the importance of the research evidence, and we'll provide a little bit of that background on the research, and then the importance of disseminating accurate information. So as you know, this webinar is all about the Mythbusters, so we'll address why that research background is so important and making sure that we are disseminating accurate and factual information. So we'll discuss then some of the common misperceptions that we hear from clinicians and individuals with Parkinsons and individuals in that community related to both LSVT Loud and LSVT Big approaches. And then we'll provide some clarifying statements that can address those misperceptions related to these treatment programs. And then finally, we want to make sure that we leave you armed with strategies and solutions to help overcome any of these challenges or barriers to implementation that you may be hearing about or encountering yourself. So we want to make sure that you're again, ready to kind of take those on. So we're here to help you figure out strategies and solutions. So what we want to start with is we want to know who's joining us. So this is a public webinar, so it's open to anybody. So, you know, individuals with Parkinson's or family members, caregivers, friends, also allied health professionals, other people in the medical industry. So we just want to know who's here today as we're presenting our content. So what I'm going to do is pull up a poll. So let me just get this launched. And then if you can select which category you're in. Okay, let me just make sure that popped up. All right, so you should see the poll on your screen. And then if you can select your category so we know who we're presenting to today, that will help us kind of gear the content to make sure it's applicable to everyone in the audience here. All right, so I'll give you a few more moments, and it looks like we have kind of a nice distribution here across the allied health professionals and then also individuals with Parkinson's. So that's primarily who we have on the webinar, and then a few other medical professionals and then some other. So I'm not quite sure, but we know we have a good mix here today. All right, so I'll go ahead and close that. And thanks for participating in that. And then we want to let you know who we are. So LSVT Global is a company and with a mission to really empower people with Parkinson's to restore and maintain their highest levels of functional communication, mobility, and independence with activities of daily living through scientifically supported rehabilitative treatment programs. And the treatment programs that we have are LSVT Loud, which is the voice and speech treatment program, and LSVT Big, which is the physical and occupational therapy program. And so we'll get into a little bit more about what those programs are, just do a brief review so that you understand what the programs are. And then we'll also talk a little bit about the research behind them, because that research really is essential to provide that strong foundation we need as therapists to deliver the treatment, and then also as individuals with Parkinson's to know that the treatment you're receiving is evidence-based and that the treatment you're receiving should result in outcomes that are similar to what's been seen in the research. All right, so in terms of just a brief kind of overview of these protocols, so they're based on over 25 years of NIH or National Institutes of Health funded research and clinical experience. As I mentioned, LSVT Loud is a speech therapy protocol. It's delivered by LSVT Loud certified speech language pathologists. So these are individuals who have already completed the steps in their schooling to be accredited as a speech language pathologist, and then they take an extra training and certification course to be certified to deliver LSVT Loud. And then LSVT Big is the physical and occupational therapy approach. And similarly, this is delivered by LSVT Big certified physical or occupational therapists who again have already been accredited to be OTs and PTs, and now they've taken another step in certification to be able to deliver the LSVT Big protocol. And we've been on an over 20-year journey from the invention of the treatment protocols to where we are today and scaling up access to these treatment protocols. And so this slide here just gives you an overview of where it started. And you can see it started back in 1987, and that was really the initial invention of the treatment approach, and some of those looking at the impact of the treatment in small group design. After those phase 1 and 2 studies, we went on to do phase 3 studies with randomized controlled trials. So looking at things like the spread of effects of treatment, also some neural imaging, and trying to understand some of those underlying mechanisms that are associated with successful treatment. And moving on to the phase 4 and 5 studies, where we're really looking at scaling up access to the treatment. So we want to make sure that the treatment that's found to be efficacious in the lab is able to be implemented across clinical settings across the globe. And so that's really what the latest research has been focusing on. So what are the fundamentals for both LSVT Loud and LSVT Big? So they're both standardized research-based specific protocols, again, based on those over 20 years of research studies. And that's where we've come to this specific dosage and protocol and exercises that are included. So the target for the LSVT Loud is focusing on vocal loudness, and LSVT Big focuses on bigness or improved or larger movement. So we're looking at scaling up amplitude. And with that, it's not to say that we're having patients get overly loud or overly big, but it takes that amount of effort to get patients to within normal limits, loudness and bigness, and that's really our target with treatment. The mode of delivery is intensive and high effort. So there are 60-minute individual sessions, so it's one-on-one with the therapist, and 4 sessions per week for 4 weeks. So that's what it looks like for both LSVT Loud and LSVT Big. And then we have a component called calibration, and that's where we really generalize what's occurring in the treatment sessions to make sure that that carries over out into the real world, into everyday living. So we're addressing some of the sensory components that can get in the way of generalizing those treatment effects, also making sure that by the end of treatment, patients are able to internally cue themselves to this louder voice or bigger movements, and then also keeping the focus of treatment simple on that target of loudness or bigness, and then also redundant so that we can overcome any of those subtle neuropsychological changes that also may be occurring with Parkinson's. And the next couple slides, I'll just show you some of the research data on the treatment program so that you know what's been done. And what you see here, these are the outcome data from the study that was considered the first level 1 evidence for Parkinson's. And this is for an LSVT Loud. So on the horizontal ordinate, you see time in months, so going from 0 out to 24 months. And then on the vertical ordinate, you see decibels of sound pressure level, which is the acoustic correlate of loudness. So we're looking at vocal loudness specifically for a rainbow passage, which is a standardized reading passage that's used in the speech therapy community. And what you see is LSVT Loud in this red line and a comparative treatment, the respiratory treatment, in the blue line. And you'll see that at pre-treatment, the group started at the same vocal loudness level, and then we move to the 2-month mark, which is post-treatment, and we see an increase for LSVT Loud, a slight increase for the respiratory group, but not as much. And then we'll follow that out to the 24-month or 2-year mark, and you can see that those changes were maintained with LSVT Loud, but not with the respiratory group. So these outcome data have 2 attributes that allow them to be considered level 1 evidence. So at 2 years post-treatment, patients who received LSVT Loud were statistically significantly louder than they were at pre-treatment, and they were statistically significantly louder than an alternative treatment group, which in this case was the respiratory treatment. This next slide looks at the LSVT Big data, and this was comparing LSVT Big to 2 other exercise programs that were common in Germany. So one is a walking program, and then one is a home exercise program. And what's plotted here is the UPDRS motor score. And so the UPDRS is a rating scale, so the Universal Parkinson Disease Rating Scale. And again, for this, specifically looking at the motor component, or that motor score on that. The dashed line is LSVT Big, the dotted is walking, and the solid is the home exercise program. And we're looking from baseline or pre-treatment all the way out to the 16-week mark. And what you can see is starting at the left at 4 weeks, that LSVT Big had a significant improvement. A downward movement of these lines indicates improvement. So they had a significant improvement, and then that improvement continued out to the 16-week mark. So some nice data comparing LSVT Big to 2 other exercise programs, again, that were common in Germany where this research was conducted. And so let's look at what the LSVT protocol looks like. And it's broken down into 2 halves. The first half of every session are what's called the daily exercises. And with this, we're really rescaling the amplitude of motor output through kind of core loud exercises. So we have a sustained ah, or saying ah with loud volume. So ah for a minimum of 15 repetitions. And then we do high and low ahs. It would sound something like this. Ah, that would be a high, and low, ah. And we would do a minimum of 15 repetitions of each of those. And then we do what are called functional phrases. And those are 10 phrases that patients say every single day. And we have them do those phrases as part of treatment. And we'll have them read those 10 phrases 5 times. And that's always the first half of every treatment session. The second half is what we call the hierarchical speech exercises. And that always takes up the second 30 minutes. And these train that amplitude from those core exercises into more context-specific and variable speaking activities. So we progress in length and complexity from week 1, looking at words and short phrases, week 2, practicing sentence level, week 3, getting into more continuous reading, and then week 4, getting into conversational practice. So We take that new loud voice that we worked on in the daily exercises and again implement that across the hierarchical speech exercises throughout every session and throughout all 16 sessions of treatment. For the LSVT Big protocol, we're looking at, again, daily exercises. So exercises extending movements from floor to ceiling, side to side, forward step, sideways step, a backward step, a forward rock and reach, and a sideways rock and reach. Again, you can see for this, for LSVT Big, there are also multiple repetitions of these exercises. There's also a walking big component where individuals do a walking portion of the treatment every single day, and then functional component tasks. And these are 5 everyday tasks that are selected by the client, and that we do these again every single day of treatment as well. Some examples of this might be working on sit to stand, pulling keys out of a pocket, navigating a cell phone, and then the hierarchy exercises will take up the second half of the session, and these will be patient identified tasks. So getting out of the car, maybe playing golf, getting in and out of bed, and these also will build complexity across the 4 weeks of treatment, working towards individuals' long-term goals. The homework practice will also be assigned every day. I'm not sure if I mentioned that with LSVT Loud, but there's homework in both protocols, and that includes working on the daily exercises, the functional component tasks, and big walking, and that homework would be all 30 days of the month. So the first half are the core amplitude rescaling exercises, and then what we're doing is translating that amplitude to functional, salient, individualized goals. So that gives you a little bit of background on the research and what treatment looks like. And so we'll kind of shift gears and now talk more about some of those misperceptions that may be common or maybe that you've heard. And what we really want to do is making sure that we're implementing treatment just as it was done in research, and that we're translating that knowledge into clinical practice. And that's really at the heart of the matter. What we see is that these misperceptions about beneficial treatment interventions can cause patients to forfeit the gift of these life-changing results. So maybe you as a patient or family member have heard about these programs, but there's just something that seems to be getting in the way, or something that you've heard about that makes it seem like you won't be able to do the treatment. Or as a clinician, you think, oh, I can't implement this in my setting. So we want to make sure that you're informed, that you're educating yourself, that we're helping educate you on the facts behind these protocols and how they can be implemented successfully. So what we want to do now is invite you to participate a little here, and take a moment and think about, what do you hear? So what's a misperception that you may encounter in either your workplace or whatever environment that you're in related to either LSVT Loud or LSVT Big? And you can type it in that question box, and then Laura and I will see those as they come in, and we'll make sure they get addressed during this presentation, either through content we've already prepared, if it's a misperception that we've already prepared for you, or at the end when we open it up more for Q&A. So I'll give you a moment to think about that. And as you're thinking about it, I'll just go over the definition for myth and misperception, which we do kind of use interchangeably throughout the webinar. So a myth is an unfounded or false notion, and a misperception is a false or inaccurate perception. So again, we'll just give you a few moments to think about what's a misperception that you've heard, to make sure that we can address this during the presentation tonight. And so I'll just share with you a common misperception that I've heard for those, before they're beginning LSVT Loud, either as clinicians or as clients. And that is that clients won't be able to commit to 16 sessions of treatment, that it's just too intensive. So I'll break that down and we'll talk about it further in the presentation, but here I'll just give a couple kind of responses to that misperception. So the first is that it does need to be 16 sessions. So you saw the research, and we have more research that we can certainly educate you with, but that's the dosage that was conducted in the research studies, and that's what's been found to provide the best outcomes. And so that's why that dosage is so important, to have those 4 days a week for 4 weeks. So that's the first thing, is that does have to be the dosage. So then you get the concern, oh, I won't be able to commit to that. And so what we've seen is, usually with education and involvement, that patients very much step on board when they see, oh, okay, 16 sessions, it has to be done that way because that's how it was done in the research. Yes, I can do that. I'll figure out a time to schedule this. So that's the first way to look at it. And then as a clinician, also just knowing, if you typically don't see a patient for that many sessions or see a patient for 60-minute sessions, maybe it takes educating your administrator to let them know, for this patient, I do need to see them for this amount of time in order to achieve the same results that were done in the research. And sometimes once that education is out there, the administrator is understanding and is able to provide those the necessary time required to deliver the efficacious dosage. So those were kind of just a couple points that I would make if I was to receive that misperception. And Laura will present on that a little bit more here today. All right, so we'll let you keep typing in, again, misperceptions that you hear, a number one, you can think of it as the number one misperception or myth that you encounter in your environment. And I'll just kind of keep that open throughout the presentation, and we'll make sure that we address those as the presentation continues, and then also at the end of the presentation. Okay, and so what we did before this webinar is we divided up what we have heard to be the most common types of misperceptions that are out there related to these protocols. The first category would be applicability, next accessibility, third would be dosage, then reimbursement, standardization of the protocols, and then expected outcomes. So for the rest of the presentation, we'll go through and break down each of these different sections. So some misperceptions on applicability that we've heard are that the programs are only for people with early to moderate Parkinson's and that they're too intensive for people with advanced Parkinson's. On the flip side of that, we've also heard that LSVT Loud and LSVT Big are not intensive enough, or they're too easy for people with early Parkinson's. And then third, you may have a diagnosis of Parkinson's. You must have a diagnosis of Parkinson's to be eligible for LSVT Loud or LSVT Big. So now I'll turn this over and kind of clarify some of those statements and then offer some solutions or strategies to show you that implementation can be successful. So the first one, thinking that LSVT Loud and LSVT Big are only for people with early or moderate Parkinson's. And so with this, a clarifying statement that we would provide is that patients with advanced Parkinson's, due to maybe increasing problems with memory, attention, processing, and motor learning, can benefit even more from repetition and training to learn a skill. So you saw how both protocols have a lot of repetition in them, and that's for a very specific reason, to make sure that those changes do become more ingrained and will last outside of the treatment room. And so patients, again, that are more advanced require even more of that repetition and training to learn the skill. So it can very much be applicable to those populations. Also, within treatment, the intensity is scaled for exercise that is medically safe and does take into account any potential comorbidities that might exist. So in terms of solutions and strategies for clinicians and patients with this, as a clinician delivering the treatment, the focus would be really remain simple and redundant. So the loud, you would really focus on loud for the patient when delivering LSVT Loud. For LSVT Big, you would really focus on big movements for the patient. And as the patient, that's all that you're going to have to focus on, is being louder and being bigger. And the clinician will kind of shape you and steer you the rest of the way. But you only need to follow their model of being loud and their model of being big, and it should be simple and redundant. There's also a customized treatment plan and goals that will be specific to patients' needs. So again, with these populations, the focus might be more on basic activities of daily living, communication, and mobility for basic needs and safety. So to make sure those functional components are really addressed. So patients would still complete the entire LSVT Loud or LSVT Big protocols, and the exercises would just be adapted as needed. For example, for LSVT Loud, you would still do the same exercises, but maybe you wouldn't have as many repetitions. Same thing with LSVT Big. So this we have some other on-demand webinars that have covered this topic specifically and in much more depth than we can go to in this presentation. So if you are interested in learning more about these populations, we have on-demand webinars that are available on our website for both atypical and advanced Parkinson's, for both LSVT Loud and LSVT Big. So I would encourage you to look at those if you're interested in learning more about those populations and working with them, or if you fall into one of those categories. So the next misperception, again, kind of flipping that one around, is the notion that LSVT loud and LSVT big are not intensive enough, or they're too easy for people with early Parkinson's. And so with that, we provide a clarifying statement saying that patients with early Parkinson's can benefit from those additional challenges. So perhaps adding in dual motor and cognitive exercises to help drive neuroplasticity, or what we call changes in the brain, and optimize that real world function. So the goal with working with these patients who are earlier on in the diagnosis would be to slow symptom progression, prevent decline and secondary impairment, and help to maintain current level of function and participation and communication in occupational roles. So we want to make sure that you're able to continue to participate and that you don't let your disease get to a point where it does really impact your day-to-day living and then you go to treatment. So we want to get you before you hit that level. And then in terms of strategies and solutions, so just know that LSVT loud and LSVT big should never be easy or boring. So even though there are a lot of repetitions, it never implies that it's boring. So clinicians will add in challenges. So they might increase repetitions or duration of time that you do an exercise. Add in some dual cognitive and motor tasks. So for example, they might have you reach in your purse and grab a specific amount of change while you're saying your functional phrases. Or they might say, okay, do a long, loud ah. At the end of the ah, I want you to tell me what 72 minus 13 equals. So they'll add in some extra challenges for LSVT big, increasing speed or resistance, or adding balance challenges, agility, endurance. So there's always ways that we can scale up the challenge for patients that may be earlier on or just can tolerate these higher levels of challenges. And then also we'll be sure to include salient tasks related to occupation and community involvement. So we really want to make sure that the exercises are salient or personalized to you, to clients, so that they are more meaningful to the clients. And so we also have some on-demand webinars that dive into this topic a little more in depth. So early Parkinson's disease, both on LSVT loud and LSVT big. And then am I too early to start LSVT big or LSVT loud? So for your reference, those are some webinars that will dive into that a little bit deeper. And then another misperception we've heard is that you must have a diagnosis of Parkinson's to be eligible for LSVT loud or LSVT big. And to clarify that, so you don't have to have a diagnosis of Parkinson's for either of these treatment approaches. There's a combination of history, examination, stimulability testing, and clinician judgment that goes into assessing whether a patient of a different population may be appropriate for LSVT loud or LSVT big. If a clinician does find that a patient may be appropriate, then the clinician would do a 1-week trial of the treatment to determine if the patient should continue on for the rest of the 3 weeks or a full 4-week protocol. So that's the way that it would come about, to see if someone outside of a diagnosis of Parkinson's may be appropriate for these protocols. So some strategies or solutions. So the clinician would look at your chart review. Is intensive exercise safe for this patient? Are there any contraindications? Do I need physician clearance? Are there any cardiac or respiratory issues that could get in the way that I need to have cleared to make sure that I can do an intensive protocol? Also a literature review. So on our website, we have a list of all the studies that have been done related to LSVT loud and LSVT big. And you can look at those and see if the population that you're interested in has been studied. So we don't have the wealth of research like we do for Parkinson's, but there are certainly case studies and small group studies that have been done in other populations. So you can also look to the literature to see what are the types of outcomes that other people have gotten. And then what is the response to stimulability testing? So when you ask a patient to get louder or move bigger, is the patient able to do that? And does it make a difference? So do they have bigger movements, better movements, improved communication? So you're trying to stimulate them for loudness and bigness during your assessment to see if you think the treatment may work. And then we have an on-demand webinar that will be helpful for this topic also. So LSVT loud and LSVT big beyond Parkinson's disease. Could they be helpful for my condition? So we'd encourage you to check that out if you're interested in learning more about this. So some additional misperceptions on application which patients may have. So I was just diagnosed and I don't have any problems with my voice, mobility, or balance. Or I'm very physically fit and exercise often, so I don't need either of these treatment protocols. I've had big or loud for a few visits and it just didn't work. so I don't want to continue, or I don't think it's right for me. LSVT protocols are just a simple set of exercises that you can learn from the homework helper videos, or intensive exercise groups are adequate or a better choice for people with early Parkinson's. So here are some solutions or strategies we would have you look into to try to counteract some of those misperceptions. First, use it and improvement. So that's one of those neuroplasticity principles. If you want to improve your voice or improve your movement, you need to use it to improvement. So like I was saying before, you don't want to wait until it's broken or until it's more difficult to do your daily activities that you like to do every day. We don't want to wait until you aren't able to participate in your same job responsibilities or community organizations. We want to get you before you've dropped down to that level. And then just educate yourself and educate others that exercise and therapy are complementary. So we would never ever discourage exercise. It's always wonderful to exercise, but therapy from a skilled professional who specializes in Parkinson's can be such a huge benefit, and that can be complementary to an exercise routine that you're already in. So we do also have some on-demand webinars related to this topic. So exercise versus therapy for Parkinson's. How do I decide? Exercise is great, but how will that improve my function? So that gives you some things to look into if you're facing some of these misperceptions in your environment. So I'm going to turn it over to Laura, and she'll get into our next category of misperceptions, this one on accessibility.
All right, thank you so much, Beth. And this one is near and dear to my personal experience, working all of my professional career in a very rural area. In fact, I was the first LSVT big trained clinician in more than a 4-state area, but working closely with the movement disorder specialist. And so early on, it was easy to have the wrong assumption that for people that were living far away from where my practice was located, that it was never feasible for people to make a lengthy commute to my clinic 4 days a week. And so we'll be talking today about some solutions that we've found both through my personal practice and others' practices of how this can be possible for patients who desire to receive the LSVT protocols. So a few clarifying statements on accessibility. First of all, we want to be upfront and just acknowledge that, yes, there can be challenges to commuting to an outpatient clinic or a hospital-based clinic 4 days a week. Could be distance, could be mobility issues, lack of transportation, or several other things. Could be scheduling related as well. But we have seen that these barriers can be overcome through creative solutions, both on the therapist's end and on the patient's end, along with education on the importance and value of intensive dosage. So here are a few solutions both for you to consider, whether you are a therapist attending our webinar today or a person with Parkinson's or a caregiver. So my role as a therapist is this, and I think this is true for all of you therapists that are listening today too. We assess our patient. We might have ideas of recommendations of treatment options for that patient to consider. And I think the best thing that we can do as healthcare professionals is to respect our patients' autonomy and give them choices. So if LSVT loud or LSVT big is one of those choices, you're certified in delivering those treatments, that might be one thing that you recommend, but there might be other things that you can offer to that patient as well. But I think it's our job, if we are trained in LSVT, to share with them the value, the strong evidence backing these protocols so that we have confidence that these treatments will work if the patient participates in them. And I think for all of us, if we go to a doctor's office and we're being treated for a certain condition, we want our doctor not to make assumptions about what we can afford or what we can handle as a patient. We want to know what all the treatment options are, what his recommendation is, so that we can make a well-informed decision that's right for us. And so what I learned in my practice is that when I give patients autonomy and respect their right to make their own healthcare decisions, a lot of them came up with solutions that I didn't even know were in the realm of possibilities. I've had several patients that have offered that they had a friend or a relative that lived in the community where I worked, and they could stay with that person during the weekdays for a month, and that was no problem because they were retired. I've also had patients that have said, you know what, I have several friends or relatives that have said in the past that they're happy to help me have a ride to therapy. And so if you have options like that, those are the times to call up those friends and family and say, hey, you know, I want to do this therapy. I might need a little help. Are you willing to help me get transportation? For patients, sometimes also it's possible that you can actually receive your therapy in home. In fact, there's a number of growing practices throughout the United States where you don't have to be what's considered homebound, but you can actually conveniently receive therapy in your home, and it's billed under regular insurance or Medicare Part B. So that might be a solution that is possible in your area as well. Another thing that I've done as a therapist is really advocate for clinicians to get trained in rural areas. And sometimes it can be done quickly. If you have someone on board, they can get trained in as little as 2 days. And sometimes it just takes time and continued advocacy and dissemination of information of what LSVT is. And personally, I saw this happen in my state, that we went from just myself as a therapist to many trained clinicians in very small communities. Part of that education is information that LSVT protocols can be used for more than just Parkinson's disease, and can be used for other diagnoses as well, which is quite helpful. In LSVT Loud, we have a couple of different technology options that make treatment more accessible as well. In some instances, LSVT Loud can be delivered via telehealth in a protocol called eLoud. And also we have an FDA cleared medical device called the LSVT Companion software program that enables you to do possibly part of your LSVT Loud sessions in the home. So if you're interested in those options, contact us and we can tell you a lot more about that. We also have webinars on those topics as well. But bottom line, education on the importance of intensive dosage creates a position where the patient can consider the value of these treatments and make that decision on their own. So in the next slide, let's talk a little bit about therapist misperceptions on dosage. And oftentimes we hear from therapists, well, we think the dosage is too high, and we believe that, you know, in certain instances, LSVT Loud or LSVT Big can be completed in fewer sessions or shorter sessions. Sometimes we hear that patients won't be able to come to treatment 4 days a week for 4 weeks, or maybe it's a scheduling barrier that my clinic only allows 45-minute sessions or slots for treatments, or maybe the therapist works full or part-time and not 4 days a week, and so isn't certain about how they can become certified and deliver that protocol. So in the next slides, we're going to talk about some of these solutions. One of the clarifying statements that really, again, is important, I think Beth underscored this well, is the research. And we talk about this a lot because really the research on LSVT Loud is undeniable. It's the only treatment, speech treatment, with level 1 evidence. And in fact, it has 3 RCTs, and LSVT Big has 1 RCT and is growing in the amount of research as well. And all of those show that this dosage is effective. But we have no evidence to show that a lower dose can be just as effective. And so when you're dealing with something so important and valuable as your health, we feel, why risk it and lower the dosage if we have no idea if it will work? And as an analogy, we always say exercise is a medicine, and we know that a pharmacist would never alter the dosage of medicine on his or her own volition, when there's research on that drug which has shown that there's a specific dosage for the optimal treatment of symptoms. So take your exercise just as seriously as you take your medicine for Parkinson's. Next slide. Also consider the repetition of an athlete in training and the intensity of training to really become an expert at that skill. And we know through the research on neurorehabilitation and neuroplasticity and motor learning, it really underscores the need for training that's sufficiently intense, frequent, and repetitive. And those same principles that make athletes excel at their sports apply to people who are fighting Parkinson's disease. And on the next slide, we'll see that it's not just behavioral changes that we are making in people with Parkinson's. We're actually making structural or physical changes in the brain. So a couple of clarifying statements on dosage for you to consider. In addition to the behavioral changes, these neural changes have been documented in the literature post-LSVT loud. And a study by Narayana shows that this intensive exercise can have an impact on neural functioning. And you can see in this PET imaging scan the changes in activity pre and post LSVT loud. Next slide. Now, in terms of patient dosage solutions, again, it's a myth that patients will not ever be able to come to treatment 4 times per week for 4 weeks. But what we found through practice is that once a person is educated, oftentimes patients say, wow, you know, time flies. I really don't want to stop coming to therapy because they enjoy it so much. It's empowering for patients with Parkinson's. They really benefit from the energy and the enthusiasm of the therapist. And it's sometimes difficult to say, oh, do I really have to stop now that these 16 sessions are over? So if you're a therapist, consider, you know, twice a week for 8 weeks doesn't seem so much. And so 4 times a week for 4 weeks obviously is the same 16 hours. If you're a patient, look at the big picture. 16 hours in 1 month does seem like a lot when you think of it up front. But if you think about the thousands of hours that you'll have Parkinson's for the rest of what's hopefully a very, very long life, it's a very small investment in your health and your quality of life. Next slide. So some clinician dosage solutions are these. It's really common nowadays that a lot of clinics only have 45-minute blocks allowed for therapy appointments. And we would just encourage you to educate your administrators and schedulers on the research and the importance of this intensive dosage. And really just stand up for yourself as the professional of, you know, being guided by the evidence rather than being guided by the calendar and the schedule book. Some ways that you can also benefit from this is to provide 1 or 2 slots per month of LSVT Loud and LSVT Big that are just dedicated to those patients. Some clinicians have had LSVT camps where they 1 month out of the year, that's all they see is LSVT patients to make that scheduling a little bit easier for that 1 month of the year. And for LSVT Big, if you're a US-based clinician, recognize that our treatment, of course, is time-based. And so 3 60-minute slots or 4 45-minute slots is the same thing in terms of reimbursement. So it's really just how you present this to your administrators and your schedulers, coming with prepared solutions on how you can make this work for the benefit of your patient. For LSVT Loud, you can use that LSVT Companion software system for some of the at-home LSVT Loud sessions. And so we have 2 versions. We have a client edition and a clinician edition, and the client edition can be used for some of those home sessions. For therapists that work part-time, it's a very common scenario that therapists, both PT, OT, and speech, work part-time. And typically it works really well if you share the patient with another LSVT certified clinician. So maybe one of you sees a patient twice a week and the other sees the patient another 2 times a week. In LSVT Big particularly, the pairing of PTs and PTAs or OTs and CODAs is quite common and also gives you a lot of flexing of your schedule. And then lastly, for LSVT Big, PT and OT can together work on provision of LSVT Big to a patient. So sometimes it's twice a week PT, twice a week OT. They're working on discipline-specific goals under the context of LSVT Big. Next slide. So some really important misperceptions on reimbursement that we want to spend some time talking about. One of these misperceptions is that you cannot provide LSVT per protocol because of Medicare therapy thresholds, especially if they receive speech and PT in the same calendar year. The other is that these LSVT programs can't be reimbursed in the home health setting when delivered per protocol of 4 times a week for 4 weeks. So let's take a look at this misperception a little more closely, along with some of the clarifying statements and solution. So the fact of the matter is that the LSVT programs are successfully reimbursed in the United States and around the world, and have been for many, many years. And because of this positive reimbursement, these programs continue to grow. Currently, we have over 30,000 certified clinicians who are implementing these protocols in 73 countries around the world. So they both provide the best practice recommendation for outcomes and documentation, which are necessary to positively support reimbursement. If you're not too knowledgeable about Medicare, you might have heard in the past that there was a Medicare therapy cap, but this was repealed about a year ago, and so there no longer is a Medicare therapy cap. There is a threshold, and basically all the therapist has to do is to continue to document the medical necessity and apply something called the KX modifier after they reach that threshold. And knock on wood, so far that has been going well for therapists that have been billing Medicare for LSVT when they document appropriately. Some of the solutions for therapists are these. Our training course provides many resources for documentation, statements, and goals, as well as codes that they can use when they're doing their treatment reports or assessment reports. Advocacy and education is important so that our managers understand what these protocols are as well, so that they are willing to support you in your practice of LSVT. We also have experts on deck, and so whenever you have questions about reimbursement, whether you're a person with PD or a therapist, we always encourage you to email us at info@lsvtglobal.com. And on the bottom of the slide here, we've listed a webinar that provides many more in-depth answers than we can provide today on insurance coverage and considerations for LSVT Loud and LSVT Big. Sorry about that. Didn't realize that my microphone was muted. Some therapists also have the misunderstanding that they will get bored with repetition, or they are concerned that they won't be able to use their clinical skills. Next slide. So a few clarifying statements on standardization. These standardized protocols are supported by years and years of research and incorporate principles of neuroplasticity and motor learning. So it's not just that the protocols are supported by principles, which is important, but they have their own independent research on the protocol specifically. However, within the structured protocol, it's really important to know that the treatment activities and goals are all personalized and tailored to each individual person. Next slide. So why do we have to have this intensive standardized dosage? Well, we know that people with Parkinson's disease need even more repetition, as the non-motor symptoms of Parkinson's affect learning, attention, memory, and more. And so they need practice, practice, practice. And it goes back to that slide where I talked about training like an athlete. Our goal is to make structural changes in the brain, which result in lasting behavioral changes for our patients. And we know that this intensive dosage is a minimum dosage, and in fact, sometimes even more repetition and training is needed After therapy, our patients continue to practice daily to help maintain those gains with the goal of slowed symptom progression over time. Next slide. So you see in this picture a potter really shaping this pot to be exactly the way that they want it to be. And so it is with LSVT. So the protocol is standardized and the target is vocal loudness or bigness of movement, but the therapist is constantly looking at each person individually and using their clinical skills and knowledge to shape their output so that it's the best possible voice and best possible movement. And so this is why it really can't be a group treatment, because that therapist is so intensively focused on each unique person that presents with Parkinson's symptoms in a little bit different way. Next slide. Some clinician solutions for standardized care and delivery of LSVT. You might be wondering how you can personalize treatment if you have to follow that same protocol for every patient. Well, the key is saliency. You have to personalize your materials. You can't use a workbook and just pick an activity of the day. You really have to delve in and find out what's important to your patient, what really motivates them, what makes them tick. And you have to make your goals very tailored to that patient as well. And so we've listed some goals here, examples of some with early PD and more advanced PD. And I'll just go through the early one for the sake of time. But for someone with speech deficits, the LSVT loud goal might be that the client's able to effectively project voice during business meetings and phone calls. And for LSVT big, maybe again it's work related, but the goal is that the client will be able to walk over uneven terrain and climb ladders while they're talking so he can safely continue his job as a construction manager. Next slide. So some solutions for you if you're a clinician. If you're worried that your patient's going to get bored with repetition, be sure to personalize the materials and exercises so they're salient. Add challenges. Always be thinking, what can I do to make it more challenging, more engaging, and be energetic, because our patients feed off of that energy. So if you're bored, they're going to be bored. So always make sure that you're thinking about what you can do to make it fun and meaningful for that patient. If you're concerned that you won't be able to use your clinical skills, you're very wrong. And what you'll find after you're trained is that the cue for the patient is simple and redundant of think loud or think big. But you as a therapist are always spinning your gears at a high rate in the background. So you're constantly thinking, what can I do to improve their output, to model, to shape, to really achieve that best voice, that best movement? How can I make it harder for that patient so that they can achieve even more over time? Next slide. And our last category we're going to go through today before we take questions is our expectations. And so we want to make sure that people don't have misperceptions on expected outcomes. Sometimes people have the misperception that the LSVT protocols make people shout or yell or move in an exaggerated way. And certainly we want to address these as they are myths and not facts. Specifically, patients might think that they'll look and sound unnatural because they'll be talking too loud or moving too big. Sometimes patients think that they won't benefit from loud because they're more concerned about their articulation and loudness. Sometimes therapists believe that patients are at increased risk for hyperfunctional behaviors when asked to get louder. And sometimes patients feel that, you know, my walking's not a problem, it's my fine motor skills like buttoning, and LSVT big can't help with that. So let's address those one by one. Some clarifying statements for you. Although we use the words loud and big, the treatment goal is to rescale up to normal and not result in a voice or movement that's exaggerated. What we do know is that there are deficits of the sensory system, and so that quieter voice and smaller movements might feel quite normal to the person with Parkinson's. So in order to rescale it up to normal, it may in fact end up feeling like it's too loud or too big to the person with Parkinson's, when indeed it's actually at a normal level. It's our skill as therapists to shape this amplitude that's just right, that's healthy, that's optimal, that's neither too small nor too big, so not too soft nor too loud. Next slide. Some solutions on expectations. Let's continue with this. When the patient feels that they are too loud or too big, what do you do as a therapist? Well, the most important thing we can do initially is educate on those sensory deficits. And we provide diagrams and explanations that will train you in when you get certified, so you know how to have those conversations and reassure patients that you will never let them leave treatment with a voice that sounds too loud or funny or movement that is very exaggerated in nature. It takes lots and lots of recording, feedback, playback, repetition, practice, carryover assignments, over 16 sessions to help people with Parkinson's really get comfortable with this. And that's part of the rationale for this intensive training and dosage as well. Next slide. One of the other myths is that the patient will not benefit from LSVT loud because they're concerned about articulation, not loudness, or they think that they won't benefit from LSVT big because they have other problems like speed or fine motor skills or activities of daily living, but not amplitude. But we know through years and years of research that there's a huge spread of effects that occurs both in LSVT loud and LSVT big. And so although the target is amplitude, we see improvements in brain imaging, swallowing, articulation, the perception of the listener, and more. And for LSVT big, we see improvements in speed, balance, activities of daily living, fine motor control. And so those things do improve, and it's really exciting as a therapist to see that happen. If you want to look at these studies in particular that look at spread of effects, all of our research is listed on our blog, and we've listed the URL here for you. Next slide. And so lastly, and importantly, we want to dispel this misperception that patients are at an increased risk of hyperfunctional behaviors when they ask to get loud. Our literature documents that the LSVT loud exercises actually do not create hyperfunction. As a therapist providing LSVT loud, that therapist should never ever sacrifice quality for loudness. We're always working on healthy vocal loudness. And as a patient or as a caregiver, you should be able to hear that on playback, that the patient is not shouting or screaming, but in fact is loud and can be heard in a normal, healthy way. As clinicians, we use our clinical knowledge and skills to shape that optimal voice. And so if you're ever concerned about whether your voice sounds too loud or not loud enough, your clinician is really the best one to give you that feedback and reinforcement and to shape your voice as necessary. So in summary, we hope we've shown you that it is important that providers and patients are informed of the research on the LSVT programs and adequately educate others so that our patients with Parkinson's and other conditions can receive the highest quality of care. That's really at the heart of the matter. We know there's challenges to implementation in the real world, but most of these challenges can be overcome with education and advocacy and respecting the autonomy of our patients as well. So we are here to help you receive the best possible LSVT program if you're a person with Parkinson's or another diagnosis. And if you're a therapist that's considering getting trained, we are also here to answer any questions that you might have before you make the decision of whether to get certified yourself. So in these next few minutes, if you're able to stay on, we do want to take a few minutes to answer your questions. And just to review, there's a few ways that you can ask your questions. One is you can type your question into the control panel and we will read those and either Beth or I will answer them. The second is that you can raise your hand. You can click on that little hand icon on your control panel. Once you do that, we'll call out your first and last name and unmute your microphone. Make sure that your microphone is unmuted as well if you do that so that we can hear you. And third, if we run out of time today or you think of any questions later, please do email us at info@lsvtglobal.com at any time, and we'll be happy to answer your questions related to LSVT. So I'm going to turn over to Beth, and we'll just see if we have any questions that have rolled in yet.
All right, great. Thank you, Laura. And I just want to say, since we're at our hour mark, if you do need to sign off, you can certainly X out of the webinar, and you'll get the survey will still pop up on your screen. And at the beginning, I don't think we mentioned anything about continuing education, but if you are interested in receiving a certificate from viewing this webinar, as long as you've been on for the entire hour, you can receive a certificate which documents your attendance. So this webinar is not state or ASHA registered for CEUs, but you can use it for self-reported CEU credit. So you'll just email webinars@lsvtglobal.com or info@lsvtglobal.com, and then you can request a certificate for participating in the webinar here today. So yes, we have had some questions come up. So one is, so Laura, if you want to take this one. This is from a physical therapist. Can PTAs be certified in LSVT Big? So can physical therapy assistants be certified?
Yes, they can get certified in LSVT Big. The only thing that you should know about that is the treatment delivery has to be paired with an LSVT Big certified clinician. So at the minimum, the LSVT Big certified PT should do the evaluation, and if that treatment intervention is chosen, then that PT would set the plan of care and goals that are very specific to LSVT Big. Of course, supervise the LSVT Big certified PTA as required by their State Practice Act and as beneficial for the patient. And then the treatment delivery can be handled by the LSVT Big certified PTA. The same goes for OTs and CODAs and SLPs and SLPAs as well. And I can answer the next question too if you want, Beth. It's about, do you recommend 4 days in a row in a given therapy week or 1 day off in a 5-day week? Great question. So the treatment research on LSVT Big and LSVT Loud is 4 consecutive days a week. Now, if you are in a practice setting where you provide therapy 5 days a week, consider this the minimum dosage. And so if it's appropriate and beneficial for the patient to receive more sessions per week, like 5, certainly we have no problem with that, as it really falls in line with those principles of repetition and neuroplasticity.
All right, great. Thank you, Laura. And we had a comment earlier on in the webinar that someone wanted to see the LSVT Big treatment session slide again. So I just have pulled that up. So you should see that on your slide here. So this again just breaks down the LSVT Big treatment session from the maximum daily exercises to walking big, including functional component tasks and hierarchy exercises, as well as homework, which is included all 30 days of the month. So even though treatment is 16 days of the month, you would receive homework all 30 days of the month. And with homework for LSVT Loud or with LSVT Big, clients would be expected and would need to continue to do homework for the rest of their life. So 1 time a day for the rest of their life is what we say, to be able to maintain the gains that you make during treatment. So again, this is just the slide that someone had wanted to see. Again, you'll get the handout, so you'll have this as well. And if you do have specific questions on this, feel free to type those in and we can address anything specific to the slide or the protocol. Okay, there was a question that came in regarding telepractice. So telepractice for LSVT Loud and what are our experiences with that. So telepractice has been studied and documented into the literature specific to LSVT Loud with some really great outcomes. Deb Theodoros is the SLP who's done most of that research, and she's based in Australia and has some really nice studies documenting that the changes that are seen through LSVT E-Loud or telepractice delivery of LSVT Loud are comparable to changes that we see when all 16 sessions are delivered face-to-face. So basically what LSVT E-Loud or telepractice delivery is, it's when the treatment is delivered via the internet. So the client is in their home or in their office, maybe they're on their lunch break, and the clinician is in their office, their home office, wherever they are, and they're conducting the session completely via the internet. So depending on where you're located and where the client is located, there are some regulations in terms of licensing. For example, typically you need to be licensed in the United States, at least in the state that you're practicing in and the state where the client is receiving the treatment. Some states require that the evaluation is done in person. I know at least I used to be licensed in Texas when I lived there, and you had to do at least the evaluation in person, but you could do the sessions of treatment all via telepractice. So the research has documented some really nice outcomes, again, comparable to face-to-face. My personal experience, I've really loved it. It lets you see clients who may not otherwise be able to come to treatment who don't live near a certified clinician, so it can be a really nice option. Okay, and Laura, if you want to take this next one, so this looks like it's from a person with Parkinson's. I am falling a lot. What is the recommendation for that?
All right. Yeah, common with Parkinson's to have falls, and sorry to hear that about you in your life, but I want you to know that there's hope for that. I would strongly recommend that you be evaluated by a physical therapist who can help greatly to determine why a person is falling, and then to develop a treatment plan to help reduce your risk of falling and improve your balance overall. There's many reasons why people fall. Some of it is related to balance, some of it can be related to freezing, some of it's related to orthostatic hypotension. So it really takes a therapist to determine what is the cause. Now, if you see an LSVT big therapist, which of course we recommend, they will also really tailor that treatment protocol in LSVT big to address those underlying deficits. So if it is a balance, for example, many of the exercises that are part of the protocol are very challenging from a balanced nature, and so therefore improve balance. If it's freezing, that's the problem that's causing the falls. The therapy protocol can also be really tailored to address those specific things that cause you or trigger you to freeze, such as going through a doorway or turning or other things like that that might result in a fall. If you're looking for an LSVT big certified clinician, Beth can pop up a slide here while we're still on the webinar. You just go to our website, and which is lsvtglobal.com. At the very top, there's an orange button that says Find LSVT Clinicians. You can type in your zip code or your city and area, your search radius, and you can find an LSVT big certified clinician in your area. And you could see either a PT or an OT. Because it's a lot of falls, I would suggest you look for an LSVT big certified PT to start with.
All right, great. Thank you, Laura. So this is another LSVT big related question, so I'll have you take this one too. Is there a standardized outcome measure used at the beginning and end of the 16 sessions of LSVT big other than the UPDRS motor component that was presented in the presentation today?
Yes, of course. So really the same outcome measurements that you use in your everyday clinical practice as a PT, you're going to be using when you're doing an evaluation for someone that might potentially be a candidate for LSVT big. So again, those would be tailored to the individual and what you're seeing, but typically we're looking at a variety of balance outcome measures, such as the timed up and go, the regular one, the motor and the cognitive, the Berg balance scale, the mini best test, and then walking tests I think are really important as well, like the 10-meter walk test, the 6-minute walk test, and then there's other functional tests that we do as well, such as the functional gait assessment, the sit to stand test. So all of those will describe our best practice recommendations in the LSVT big training and certification course, both for physical therapists and occupational therapists.
All right, great. Thank you, Laura. And then again for you, if a clinician becomes a certified LSVT big clinician, is there a way to become a trainer of clinicians as well?
Yeah, thanks for asking. So all of the training is done by LSVT Global. And so if you want to become LSVT big certified, you have to attend either a live 2-day course, or you can take our training and certification course online that also takes about 2 days or 16 hours to go through it. However, it's self-paced. Once you are certified, you can't train other therapists or other clinicians on how to deliver LSVT big. They have to go to a training course just like you did. But we have added occasionally people to our LSVT big teaching team after they've had a lot of experience, usually 50 to 100 patients that they've treated with LSVT big. So in the future, if this is an interest to you after you become certified and received a lot of experience, please reach out to us.
All right, great. Thanks, Laura. Okay, so asking about a couple other programs. So Laura, do you have any opinions on the PD program, the Warrior program, or Rock Steady Boxing?
Mm-hmm. Yeah, you know, I feel so blessed to be living this day and time where we have so many exercise options in the community for people with Parkinson's disease. And I'm not trained in either of those, and so I can't talk too specifically about them other than being familiar with some of the principles, which are similar in terms of intensity and agility. And so I would never say that, oh, you know, you shouldn't do those things, because I think community-based exercise is really, really important for people with Parkinson's. It's not just therapy, but it's what you do in between those therapy sessions as well. But my stance is this, is like get treated by an LSVT big or an LSVT loud certified clinician to really optimize your function. And that's going to be that tailored, individualized, one-on-one training. And then with all this improved movement, you'll do even better at these community-based programs like Rock Steady Boxing or PD Warrior. And so they really should be seen as complementary and not one replacing the other. I really strongly feel that people with Parkinson's disease benefit from both. If you're ever wondering also, you know, I don't know, would I be a good candidate for Rock Steady Boxing or PD Warrior, or, you know, maybe there's other things like Tai Chi or things like that. Your therapist is going to be really your best resource, and knowing you very, very well to know, is this community-based exercise program going to be safe for me? What are all the options out there in my community for me, so that you can make, again, an informed decision of something that's going to be not only enjoyable for you, but safe for you as well.
All right, great. Thanks, Laura. That's a great summary for that one. So this is one that someone had asked earlier when I had asked that question about what are some misperceptions that you hear or encounter. And this was that a lot of people do not know what Parkinson's disease is, so we have to explain it to them. And I think this was from a caregiver. So yes, so you may certainly run into that. And just like, you know, the other information we've covered in this webinar, a lot of it is just education and, you know, educating others on what the condition is, and, you know, some of the components and factors that go along with that, some of the, you know, symptoms that you may be encountering or experiencing. And then once people are educated, they can have a better understanding of what it is and how they can best help, whether it's a friend or family member or someone in, you know, more of a medical or professional role. So let me know if you have any more questions specific to that comment as well.
Yeah, I'd just like to put in a plug for all of the amazing Parkinson's organizations that we have globally. They are tremendous resources for information on just a huge range of topics related to Parkinson's disease and atypical Parkinsonisms. So, you know, Google the American Parkinson's Disease Association, the Parkinson's Foundation, the Michael J. Fox Foundation, the World Parkinson's Coalition. Those are all really, really great information clearinghouses for people with Parkinson's, families, and caregivers.
Yes, great. Thank you, Laura. We have a gentleman that's on here. He says he's been doing homework for almost 2 years. Is there a tune-up session that we recommend? And he says, I've been doing very well so far. So, and I'm not sure if you're referring to LSVT loud or LSVT big, but for both of them, it would be a similar I guess, kind of time that we would recommend. We do, if you're keeping up with your homework, that's awesome, and that's what we recommend. Doing that daily homework is really what's going to help you maintain the gains that you make in treatment. For LSVT Loud, we do have one of the randomized controlled trials. One of those studies looked at out to 2 years and saw that individuals were able to maintain the gains out to 2 years. And again, it's not to say that that's when their voices deteriorated or they definitely needed more therapy. It's just that's when the research funding ended. So it's not to say that you can't continuing to maintain that or even improve with that daily practice. We do recommend to clinicians typically to check in with patients about every 6 months just to see how they're doing. And sometimes it's just a simple phone call. How are you doing? Are you doing your practice? They'll listen in for your voice. And just do a quick assessment over the phone, and that might be it, and then they'll send you on your way. Other times we have patients who maybe kind of fall off the wagon of doing their homework, and so we'll assign them very specific exercises for a week, and then we'll check in at the end of the week and see how they're doing. Other times it may be that a client does need a tune-up. So in your case, and this seems to be more your specific question, if you do feel like your voice or movement has gotten worse since the end of treatment, you can certainly contact an LSVT Loud or LSVT Big provider, and they can do a reassessment and see if you would need some tune-up sessions. They can range anywhere from 1 visit all the way up to 16. I would say typically it's somewhere between 2 and 6 if you've done the full protocol, are maintaining with your homework practice. And a lot of times it can just be a way to almost recalibrate or know the amount of effort that it takes to get louder or have those bigger movements. So that's what the tune-up sessions can help with, and then also get you back into the habit of practicing. You may also consider trying to find either Loud for Life or Big for Life, basically a maintenance group, and those are led by LSVT Loud and LSVT Big certified therapists, and they lead. Typically it's weekly, but there's other time frames that they can meet too, where you would meet up with a group of other individuals that have also completed the protocol, and the group would be led by, again, either LSVT Loud or LSVT Big therapists, and that can be a nice way to have that support from your peers and also get some attention from a therapist as well. So that's something to look into. You can find those on our website also. So hopefully that answers your question, but let me know if you have want any more follow-up for that. Okay. So this one is, how do I get a copy of the LSVT Big treatment session? We could not print it out. It might be because that slide was overlapping. So when we send out the handout, I'll also make sure you have another slide, or I might just reposition that slide on the handout so that you can see the exercises that are included in the LSVT Big treatment session. Okay. And then it looks like the last question is, when and where will you be offering an LSVT Loud course in California? So I was just trying to really quickly pull up on our website to see if we have one in California coming up this year. So let me just look. Or Laura, I don't know if you know off the top of your head. Let's check.
I can't think of one in the first quarter, but I would always say, just keep checking the website because courses are added fairly regularly. And our website again is lsvtglobal.com. If you go to get certified, you can follow that path to find our live courses, either for LSVT Big or LSVT Loud, or you can go straight to our store and click on live courses, and you'll be able to find the full listing of all of our upcoming live courses.
Yeah, great. Thanks, Laura. And then also, if we don't have one near you and you want to get certified right away, you can also get certified online. And so you can also find that on our website. So it's the same course, same certification. It's just online instead of live and in person. Okay, so I think that we've addressed all the questions that have come through. So if you do have questions that you think of after the webinar, please feel free to email us. We're happy to answer those questions. This slide that I just pulled up just shows you some of the upcoming certification courses that are being offered for both LSVT Big and LSVT Loud. And people with Parkinson's and guests are invited. Every course that we do, on the second day, we have a 2-hour free seminar that goes from 12 noon to 2 p.m. And you would get a free 1-hour informational lecture on whichever treatment program that we're presenting about. And then you get an hour of hands-on practice with the clinicians who are getting trained. So we always encourage more individuals with Parkinson's and their guests to attend those. It can be a great opportunity for both the person with Parkinson's and then also the therapists who are getting trained. So feel free to check out that link and see if there's one offered near you. So in closing, we just want to say thank you. We'd love to see you at another webinar. We have one next month on the spread of effects of LSVT Loud, so we hope you can join us for that. Again, check out our website. Feel free to email us with questions. And when you close out of this webinar, you will again have a survey. So we'd love if you can take that to give us some feedback on this webinar and any other comments you have about the webinar programs that we offer. So thanks for joining us. A big thank you to Laura Gousset for presenting with me. We had a really great time presenting with you all today. Thank you.
Thank you.